Mag-share na tayo ng ano. Bakit? Content. Screen.
Hello po si Gina.
Hello, Maricar. Okay, salamat po. Salamat. Thank you. Magsimula na po kami. Bye-bye.
Tapos papasok ba si Gina?
Oo, papasok siya.
Ano ulam?
Minessage ko na siya eh. Sabi niya, tinatype niya yung ayaw sa Zoom.
Sige. Apritada. Huwag ka na mag-apritada kung apritada. Nilabas ko. Ano gusto mo? Parang kung bakit chicken. Sandali lang po.
Ayan si Angge.
Replyan mo na, Bes, si Gina.
Ano nga yun?
Okay na, andyan na si Gina.
Wala pa po, ma'am.
Wala pa.
Mali yung password. Mali.
Oh, mali. Ano kaya? Tuloy na natin? Hahabol siya o ano?
Opo, habol po siya, ma'am. Papasok na po siya.
Ay, hindi siya makapasok sa ano? Sa...
Mali ata yung password niya.
Okay.
Pero papasok po siya.
First of all, congratulations lahat kayo. Okay naman. Yung mga halos naman, maganda naman ang result ng examination ninyo. At meron pa
Send mo
tayo.
yun, ma'am. Ma'am, send mo.
Ha? Madistract pa kayo eh. Madistract pa kayo. Okay.
Kala ko send mo.
Hindi mamaya na. Kasi ang concentration niya mapupunta sa grades. Hindi nakuha. Mamaya na. Pero lahat naman kayo, okay naman na nakuha ninyo lahat.
Thank you, ma'am.
Yeah.
Ma'am, putol-putol po yung boses niya.
Oh, okay. Putol pa rin?
Opo. Medyo may feedback.
Kaya patayin ko yung kamay.
I-mute na lang natin yung mga natin.
Ayan.
Okay na po.
Okay na? Oo, sige.
Okay. Medyo.
Okay. Mag-start na tayo. Pero bago tayo mag-start,
Okay po.
tayo ng wisdom kay Lord na sana maintindihan natin ang pag-aaralan natin at matandaan natin pag once na expose na tayo sa sa field. Sino may gusto mag-pray? Ay, wala pa daw si Gina. Si Gina na lang daw. Mag-pray na tayong lahat.
Sige, ma'am.
Our Heavenly Father, we thank you so much for this moment, oh God, that you guide us, oh Lord. Thank you for the breath that we take, oh Lord. And as we are here sa aming pag-aaral, Panginoon, may you be the one who will guide us, protect us, may you give us wisdom and understanding for the things that we need to learn. We pray for my student, oh Lord, that they may able to understand it and able to remember it, oh God. I pray also na si Gina ay makapasok na rin po sa aming class right now. And Lord, we ask you guidance as we studying for our lecture today. Give us more knowledge and understanding. In the name of Jesus, Amen. Okay. Okay na? Hello?
Hello, ma'am.
Okay,
Hello
now?
po, okay po.
Hello po.
Nakapasok na?
Okay.
Si Gina, hindi pa, ma'am. Mali daw yung ano, sabi niya. Baka yung yung zero niya. Yung zero,
Oo.
ginagawa niyang sandali lang.
Oh,
Baka doon.
Oo, baka doon siya nagkamali. Oo.
Wait lang.
Sige, antayin ko few minutes, yeah.
bed making.
Ano? Okay na?
Kasi yung password, may ano siya eh.
Okay na? Hindi pa rin ba?
Baka pwede humabol na lang po siya kaysa malate tayo ng malate. I-sesend nyo na rin naman po yung lecture, di ba?
Oo. So, okay
Hanggang
na?
sa mga...
Okay. So, for today, our topic is bed making. Ang main objective natin ngayon, at the end of the class, yung student will be able to define what is bed making. How to demonstrate or to do bed making in different types of bed, patient bed. To know the principle and purpose of bed making. State articles and using for bed making. As you know, that bed making is the most important nursing technique. As a nurse, as a nursing aide, as a caretaker, bed making is the very important part of our job, because that's the place of a patient where they are having their treatment done. It's also for them to rest, and everything is done in the bed. Now, introduction for this one is a hospital. Hospital bed is the piece of equipment frequently used in the hospitalized patient. Hospital beds are also found in long-term care facilities as well as patients' home. even though at home, we are using our bed. Bed is really it's a private part of our life that we really need. When you think of bed, we need to rest. So it's our, like for example, doon ka nagpapahinga, doon ka nagre-relax, and everything is done for our good health, for our in bed. So the ideal hospital bed should be selected for the impact on patient comfort. Yeah, when you are in bed, patients should be comfortable. There is safety. They are very safety. It's a medical condition and ability to change position. It's very important for our nursing for this bed making to ensure the position of the patient, especially those who are sick. Now, we have different types of bed making. Ito po actually yung actual pictures of a bed, surgical bed. But there are different types of bed making that usually we are doing as a nurse. First, we have to define the bed making. It is a technique of preparing different types of patient comfortable bed in his or her suitable position for a particular condition. It is also a process of making neat, clean bed for client in hospital. Bed is the most comfortable place for a patient for them. Because it is the way where they are getting treated, where they are being relaxed, when they have their own rest, at saka doon sila nagpapagaling. It should be, the bed should be clean, neat, and by removing the strip of linen, it should be airing by the mattress. Now, there are different simple bed making in the hospital, but I will tell you first the purpose of this bed making. It is to provide clean, safe, and comfortable bed for the patient to promote rest and sleep. It is where they were sleeping, the bed. So, when you have a clean, safety bed, it is very comfortable to get sleep and rest. Because if your bed is not clean, it is not nice, and you cannot easily sleep. If it is wet, you cannot sleep. It is crumpled, it is dirty, you cannot get good rest or sleep. It reduces risk of infection by maintaining cleanliness. Yeah, it is a way where when it's clean, the cross infection will be usually got by the patient. So even the patient may be infected, also the health workers will be also infected. That is a source of contamination also for the bed if it's not clean. To prevent bed sore, by ensuring there is no wrinkles that cause the pressure. When you have a good bed making, you prevent bed sore. Like for example, you could, alam ba niyo yung bed sore? You know what is bed sore? It's just like, there is a soreness at the back, on the feet, or any part of the body, na especially those patients who are bedridden, ang pressure point niya is usually in the pelvic area. If you have a good bed, no wrinkles, and you turn the patient side by side, it will reduce the pressure points, and the patient will not have bed sore. It is also economized. It will economize time, material, and energy. Yeah, when it is clean, if it is it's good and nice bed making, it is economy. You don't need to change from time to time, and you will not be tired changing materials. You can observe also the patient. 1 minute. You could also observe the patient and prevent complication. Because when the patient is having a good bed making, the patient could sleep, and you could prevent upcoming complications such as a bed sore or aspiration pneumonia, or the patient will get colds already, cough like that, and so many things. That is the purpose of bed making. Why we are making bed making. Now, there are so many principles why we have to do this bed making. Number one, a barrier of nursing to prevent cross-infection. When you have to do this bed making, there is a presence of infections, meaning to say microorganisms are found everywhere, to the skin, to the articles used by the patient, and to the environment. So the nurses will take care to prevent the transfer of microorganisms from the source of new host by direct or indirect contact to prevent the multiplication of microorganisms. Naintindihan? You understand, class?
Opo.
Okay. Meaning to say, I hope you understand already what is the microorganism, direct or indirect contact, preventive measure like that. Meaning to say that number one, to prevent cross-infection, so that you cannot get sick. Your patient also will not have infection or complication due to the microorganism that is found to the skin, to the articles, or to the environment. That's why we have to be very careful in cleaning, to remove and to soil and to replace the bed making, the bed. Number two principle is that a safe and comfortable bed will ensure rest and sleep that will prevent several complications in bedridden patient. Example, the bed sore or the foot drop. Meaning to say, if it's a clean or a tidy bed, the patient could easily have a good rest, sleep, and you could prevent bed sore. This bed sore is usually this kind of patient who has been vegetable or coma or semi-coma, or those patients have been done operation for a long time, or any operation like also early surgery. Number three is a good body mechanics, maintain the body alignment to prevent fatigue. As a nurse or as a clinic assistant or as a nursing aide, when you change the bed, there must be a good mechanic alignment to prevent fatigue, so that you could not easily be tired. At the same time, the alignment of your body, your musculoskeletal, still in good posture. Number four, systemic ways of function could be saving, if you could save time, energy, and materials. Performing good bed making, it will save you time, energy, and materials, because you will not changing the linens from time to time. The materials, and you could save also your energy. You become tired if you keep on changing, if you will not make things good. Number five, make all beds in nursing unit alike and uniformity of appearance. Meaning to say that all beds in the nursing or in the hospital, it must be in uniform in appearance. It does not have different color. Like for example, the one is green, the one is red, the one is bed. It's all white.
Rainbow.
White, and also sometimes there is blue.